Good morning to one and all. I am Dr. S. Mithunraja, Assistant Professor from the Department of Endodontics from Vinaga Mission Sankaracharya Dental College. I am here to talk about management of badly mutilated teeth. First, what is mutilated teeth? Mutilated teeth is a tooth which is grossly weakened and badly broken down, where the amount of remaining tooth structure is less than the amount of tooth loss. What are the contents we are going to talk about is causes of mutilation, characteristics of mutilated teeth, sequelae of mutilation, restorative treatments, pins, inlays, full coverage and other methods of treatment causes. Okay, causes of mutilation includes long-standing caries, traumatic caries and recurrent caries. What are the long-standing factors that increase the dental caries progression? Patients with enamel hypoplasia, hypocalcification, patients with bad oral habits and the patients with bad oral hygiene and the patients who are not reporting to the dental checkup regularly. Then comes under traumatic fracture. Traumatic fracture due to bicycle falls, and it may be due to also blow to the face and some sports injury, which includes a playground accidents, chewing hard habits. The recurrent caries includes, it is considered the cause of mutilation due to an already placed restoration, which causes secondary caries, which leads to the badly mutilated teeth. Next, what are the characteristics of mutilated teeth? The characteristics of mutilated teeth includes it is because of the loss of partial or complete loss of cusp, and it may also be due to the loss of marginal ridges, loss of axial walls and due to the loss of mesiodistal width of the tooth. It may also lead to the negative crown root ratio, which leads to the main loss of the mutilated teeth. Partial or complete loss of crown root junction, negative crown root junction, multiple cracks with an unlimited extent or appearance of signs and symptoms of the cracked tooth syndrome. Next comes sequelae of the mutilation. Sequelae of mutilation is how far the mutilation gets spreading. It is because of weakening of the remaining tooth substance, decrease in the retention and resistance. It may also engage the normal pulp, physiology, periodontal health and restoration of aesthetics. Drifting or over eruption of the teeth, complicating restoration and compromising the success of the restoration. Next comes the treatment of the badly mutilated teeth. The treatment includes restorative treatment for anterior teeth and posterior teeth. For anterior teeth, it is resin composite, porcelain laminate, ceramic or porcelain fused to metal restorations or any other porcelain veneers. Restorative treatment for posterior teeth includes full coverage restoration, amalgam restoration, inlays or onlays, retention locks, slots and other resin composite restoration, or cusp capping may also be the treatment of option for the posterior teeth which is badly mutilated. First comes cusp capping is needed when caries is extensive and the lingual or facial extension is 2/3 from a primary groove toward the cusp tip. Next is how the cusp capping is done is functional cusp are reduced by 2 mm, non-functional cusp are reduced by 1.5 mm. Rounding of any sharp external corners is must to reduce the stress concentration on the particular area to avoid the fracture of the restoration. Next, what are the disadvantages of the cusp capping is reduction of the cusp significantly reduces the retention form by decreasing the length of the longitudinal walls. Next comes retention locks. What are the retention locks is retention locks in dentin of the axial walls are made by using a Fisher burr. In this, the preparation for the locks are placed and the pins are placed, which gives retention to the restoration. Slots. Slots can be prepared along the gingival floor using an inverted cone burr. What are the millimeter of the slots is slots are at least 0.5 mm depth and 1 mm more in length. Next is dentine chamber. This is one of the method of treating the badly mutilated teeth. Dentine chamber is also called as amalgam pin technique. Dentine chambers are placed or prepared in the floor of the cavity with a burr parallel to the external surface of the tooth. The depth of the dentine chamber should be 2 mm. The junction between the pulpal floor and the walls of the chamber is beveled with a round burr to avoid the sharp concentration. Next is the pin retained restoration. Types of pins are 3 types of pins: the cemented pin, friction locking and self-threading pins. TMS pins are like the types of other TMS threaded matter system pins include minikin, minim and regular pins. Reinforcement of the endodontically treated teeth. How we can manage endodontically treated teeth is that there are 3 types of post. One is preformed post, which is available in the fiber post for the aesthetic concern. Next is a aesthetic post, which is a resin made composite post, and is a cast post. Cast post is a man-made, or it depends upon the tooth or the canal, from where we can segment a post or we can prepare a post according to the width of the canal. Next comes the retention using the pins, which is already we saw about thing. Crown lengthening. Crown lengthening is nothing but a gingivectomy procedures where if there is a minimal gingival width or the minimum crown root ratio, the gingiva above the crown is removed for 1 to 2 millimeter, where we can expose the crown and the root portion for the retention and resistance of the thing. Biological width. What is biological width is? Biological width is a condition which is related to the periodontal and endodontic consideration for the replacement of the badly mutilated teeth. Orthodontic extrusion. The other main managing a badly mutilated teeth is orthodontic extrusion. Orthodontic extrusion is a thing due to trauma, the tooth get extruded into the socket and it can be extruded with the help of the orthodontic appliances or other things. Okay, what is bicuspidization and hemisection? Hemisection is a procedure where a segment of multi-rooted teeth like conformed unrestorable is removed, leaving a sound restorable part of the tooth. The indications include severe bone loss, that is less than 1/4 of the normal bone left is confined to less than of the roots. Severe root decay is confined to less than all the roots of the teeth. Proximal rifting occurs, interseptal bone loss resulting in root-root contact with the adjacent tooth. This is all about by hemisection. Procedure of the hemisection is RCT performed first, then the indicated root is separated from the intact root at the furcation using a long shank cylindrical round-ended diamond burr. Indicated root is extracted, osseous contouring is done, root planing is done for keeping the root if necessary. Temporary restoration and the provisional splinting for intact root is done. Next is bicuspidization. Bicuspidization is nothing but if a molar is a badly mutilated teeth, it can be done by removing of the cusp which is badly mutilated. The other part of the tooth along with the root can be saved. Then the badly mutilated teeth can be managed. These are my references. Thank you for watching my class. Thank you.